Okay, so may I start? Yes. So I have two presentations. So first, my talk is participatory evidence-based planning for community-based control of bovine brucellosis in Tanzania. This one, okay. So the background, brucellosis is one of the most prevalent zoonoses in the world. And the disease in cattle is caused by Brucella abortus. Symptoms in cattle is abortion, and in humans, andurant fever, fatigue, and arthritis. Infection in animals occurs mainly through ingestion of bacteria in aborted materials, particularly during grazing, and also vertical transmission also exists. And humans are mainly infected through consumption of undercooked milk or dairy products. And vaccine exists, S19, but there's no vaccination campaign in Tanzania. This is the situation. And I'm going to talk some of the details, information in the next slot, but in summary, we have been conducting in the study since 2015 in Morogoro, or Tanzania. And the knowledge about brucellosis among agro-pastoralists are poor. And risk factors in cattle we found in Morogoro region is grazing and abortion. And this region has a mixture between some urban area and more agro-pastoral or pastoral dry area. And in the agro-pastoral areas, if we select those areas, those risk factors disappeared, and one prevent factor, use of veterinary service, remained. And risk of infection to humans, there are lots of risky behavior, which I'm going to explain. And the sales of cattle experienced abortion is common. They don't feel it's a sensitive question. They do without hesitation. And the cows, when the farmers sell cows, they always have to sell livestock market. And in the livestock market, majority of cows go to slaughterhouse. However, some smaller proportion of cows go to the other farms where the disease spread should occur. And willingness to pay for vaccination study, which we did. When we ask for all cattle to vaccinate, then the willingness to pay is smaller, particularly among Maasai people, because they have large herds, and it's so expensive for them to vaccinate every single animal. But if we select only cows, then even including Maasai, about 90% of farmers are willing to pay for vaccine. So that's the situation. So we have the information, and we return the results to farmers and local veterinary authorities and the medical authorities as well. So our purpose is to understand the socio-economic aspects of maintenance of the disease in cattle. And we want to understand whether community-based brucellosis control through voluntary calf vaccination, so they pay, farmers pay, then also the facilitation of selling cows experienced abortion to slaughterhouse is acceptable. So for those people from developed country may feel very strange by reading this sentence, because are you allowing to eat beef, which you know that those are infected with brucellosis? But in Tanzania, they boil or roast beef. So then by selling to slaughterhouses, then farmers can get the money So that's very important to keep the motivation for the control. So this was the aim of the study. So in the first year, if you select only calves and vaccinate them, in the next year they get immunized, and by the third year, most of the herds will be immunized. And also by selling cattle which experienced abortion, of course, I also know, as she presented, and there are other pathogens cause abortion. But if you don't have diagnostic kits or diagnostic facilities, I think it's a reasonable choice. So by selling off those high-risk animals, we think that the eradication of brucellosis may be facilitated. So we use the focus group discussion to answer the questions. I prepared the checklist of these items. And in the participatory epidemiology, you don't need to follow exactly the sequence of the questions. You can jump to the other questions when the community started to discuss. So it included self-introduction and explanation about brucellosis to provide knowledge, and feedback the research results as a group. And asking their customs behavior associated with the risky behavior for brucella infection in humans, and explanation about the brucellosis control method using calf vaccination. Of course, I experienced about the mass vaccination, not only cows. And what happens if they don't use vaccination? Then selling cows experienced abortion. And then we discussed together about what kind of methods they take. So the study was conducted in the inner area of Tanzania, and 4 villages. And some villages have a mixture of Maasai and non-Maasai. And this village doesn't have Maasai. And this dominant Maasai is Maasai dominant. Okay. Then the results, questions and answers on brucellosis. They asked me, can you diagnose all cattle and humans? And obviously I replied, no, I don't have money, and it's not sustainable. That's not the point. Then question is abortion caused by other reasons by brucellosis, like the previous study. It's very good question. Then I explained that not only brucellosis causes abortion, but when there's no diagnosis, then that may be a good choice to sell those high-risky cows. And when they sell, they get money, so it may be sustainable. And how long, another question is how long the immunity lasts. It's very good question, isn't it? Then 7 to 8 years. So once we go through calf vaccination, it's quite effective to maintain herd immunity. And the last question, where brucella came from? Very good question. I don't know, but it's very good questions. So by the communities. They never went to university, you see? We have to sharpen our mind up. And regarding feedback of our diagnosis, they mentioned that they sold their seropositive cows to slaughterhouses, or maybe they went to the other farms. So that's the thing. But they never experienced abortion after that, so they appreciate it. And risky behavior for humans, consumption of raw milk is common regardless of tribe. And raw milk tastes better than boiled one, they say. And if I knew about brucellosis, I didn't drink raw milk, one person said. But the other says, I cannot stop it because even there's a risk of the infection, because I like it. Then about consumption of raw cattle blood, it's a common practice in Maasai. And raw blood is food and water for them during transhumance. And more chance among males because male take cattle in the dry season. And they say, I cannot stop it, even there's a risk of the infection, according to Maasai adults. And role of milking, for Maasai, women tend to milk cattle, but non-Maasai, the role is not specific to gender. And assistance of calf delivery, male does, and gloves are not used as they are slippery. And for Maasai, during transhumance, they cannot wash hands because there's no water. And opinions of the brucellosis control, all the villages selected calf vaccination at their own cost. They, of course, prefer cheaper cost. And all the villages identified veterinary officers to procure vaccine and to help. And selling cows experienced abortion, it's a challenge because the seller of the cow cannot decide the direction, whether to go slaughterhouse or to the farms. They cannot decide. And it's difficult to tell buyer that my cow experienced abortion because the price goes down. So that's the challenge. Prevention of infection to humans, Maasai people actually told that I cannot change behavior, but you are allowed to teach my son. Yeah, but it's beautiful, isn't it? Yeah. And conclusion, importance of knowledge. So if you provide correct knowledge, then the communities will find the best way of solution. And control options, community-based brucellosis control through calf vaccination may be challenging to provide them motivations because there are many communities. But once it is accepted, then I think we have a high chance for the success. And selling cows experienced abortion to slaughterhouse needs help from the government authority. And prevention of human infection, education may be a key. So collaboration with school may be important. Thank you very much.